Thank you. Thank you to our panelists. What wonderful presentations today. I will tell you that the sure sign that our audience has been engaged and listening and the presentations have been fabulous is a plethora of questions. And we have, they're just streaming in. One thing that we haven't done is make sure that everyone who took the time to be with us today, that your questions got answered. And so if you have questions, I have my trusty volunteers in the back. And if you'll write them down and raise your hand, we're going to make sure that they get up here to Dr. Gimbel and our panelists. Okay. I'll reintroduce myself. Here we go. Oops. There we go. I'm Ann Garst-Taylor. I'm with AIM at Melanoma. I'm their Director of Community Engagement. And I thank you for just a moment for the opportunity for me to tell you a little bit about our foundation. If you don't know our origins, 20 years ago, Val Guild founded AIM at Melanoma after her beautiful daughter, Charlie, was diagnosed at the age of 26 with melanoma and subsequently passed away. And it became Val's lifelong goal to find a cure for melanoma. And that was the first and foremost mission of our organization. And to do that, we have founded 6 tissue banks across the country, and we are trying to collect primary tissue for the purpose of handing that then over to researchers. And we are hoping that will continue to advance melanoma research. But in the meantime, we need to support people who are living with melanoma. And what does that mean for AIM at Melanoma? Well, we believe that well-educated patients make better advocates for themselves. They make better treatment choices. And we don't want you to have to go shopping for information on Dr. Google. We want you to be able to come someplace where you feel that the information is relevant and current and accurate. And so we've developed a wonderful website. It is so full of information. I couldn't possibly talk to you about everything that is on there today, but I want to talk to you about some of the things that you're going to find on our website. We know that our most visited web pages are on the stages of melanoma and the relevant treatment. We also know that people are interested in side effects and management of those side effects. We have wonderful, wonderful information on there. If you're not a person who reads to learn, we have Melanoma 101 videos. What does it mean to be BRAF positive? So I encourage you to come and look at some of those videos that we have put up. In addition to that, we have a melanoma clinical trial matching service. In fact, we have a whole new section of our website dedicated to clinical trials. Has a clinical trial been suggested to you? Are you thinking about being a part of a clinical trial? Well, then you can come to our website now and look and learn, what does it mean? What do who do you talk to about it? Those kinds of things. We have a program called Ask a Medical Expert, which Dr. Gimbel already spoke about. Melissa Wilson works in Pennsylvania as a PA in oncology clinic, and she has offered to answer questions that patients have about their treatment. Now, she does not answer questions about changing your plan of care. That's between you and your care team. But what she wants to do is help you to understand, why is your care team perhaps offering one solution versus another? What does your pathology report mean? Or what does it mean to be BRAF positive? And then what she did was create a number of videos based upon those most frequently asked questions. And they're called From the Clinic to the Living Room. And they're wonderful. And I encourage you to take a look at some of those videos that she has made. And perhaps you have a question that she can answer for you. Another form of education, of course, are these symposiums. We co-host 10 a year all across the country. What we will do at the end of this symposium is we'll take all the presentations, divide them by topic, and edit them so that they're streamlined, and we'll put them back we'll archive them onto our website. We've already gotten a number of questions from people, but I want to hear, what Dr. Szabo said. Again, well, you can do that. Immediately following this seminar, the symposium in its entirety will be available on YouTube and Facebook Live for some period of time. Then later, about 2 to 3 weeks later, they will be divided by topic and put on our website, and then you can watch the ones that you're most interested in. And lastly, I want to talk about our podcast. We have a podcast that's called Beyond the Clinic, and it's hosted by Ray Liu, who is an oncologist from Kaiser Permanente. What we talk about in Beyond the Clinic are the kinds of things that you don't typically address when you are in, your very precious time with your oncologist, right? But they could be things like fear of recurrence. It could be things about diet. And so those are the topics, or those myriads of ways in which cancer is impacting your life. And so we have a podcast, and that podcast runs once a month. And I encourage you to take a look at some of those topics and see if they might be of interest to you. The last thing that I want to talk to you about is Peer Connect. We have a one-on-one peer support program. We have a number of volunteers. These are individuals who have gone through a full treatment, and they are now stable, and they are ready to support people who are newly diagnosed. They are not going to offer clinical support. They're going to offer emotional support. Many people who discover that they have melanoma, even though they might have a circle around them that is as supportive as they can still feel isolated. They still feel like that people don't really understand what they're feeling. And so being connected with someone who understands that, who can normalize that for you, and also who could say to you that you're living now. And we, what can you do to make sure that your life is full of normalcy and joy as possible? And so I encourage you, if you would like to have a mentor, to please get in touch with me. I want you to know that our mentors are not only patients who have completed that treatment journey, but they have gone through a training course. We have quarterly in-services, so we just get better and better at what we do. So I want you to feel confident that the advice that you're going to get is advice that we really feel like is going to make a difference for you. So here's what I want to move here and say, for those of you who are online with us, my trusty volunteer is going to put up our website address as well as my email address. Please feel free to give me a call. I'm there for you. I live on the eastern half of the United States. I answer my phone from 9 a.m. till 7 o'clock at night. You are welcome to call me. In addition to that, you can text me anytime. AIM is here for you. If you are here with us today, I put a little bookmark inside of your patient packet. There's a QR code there. We're QR coding everything. And this will take you directly to our website. Put that up on your refrigerator and come check out our website. Okay. We need to get to these questions so we can go home today. And so I am going to thank our panelists again. Thank, Banner MD Anderson Cancer Center. Thank you for being here. And I'm passing the baton back to Dr. Kimball.
With that, I want to thank you all for being online and joining us here, for being in the room. We love doing this. It allows us to interact with people who we take care of on a daily basis. And we just enjoy having these interactions. So thank you for being here, and we'll talk to you soon.